Mesothelioma cure. Mesothelioma is generally considered a challenging and aggressive cancer to treat, and there is no known cure for the disease. However, it is important to note that treatment options have advanced significantly in recent years, leading to improved outcomes and extended survival for some patients. The prognosis of mesothelioma depends on various factors, including the stage of the disease at the time of diagnosis, the location of the tumor, the extent of spread, the histological subtype, and the patient's overall health. Unfortunately, many mesothelioma cases are diagnosed at advanced stages when curative treatment options become limited. That being said, advancements in treatment strategies and emerging therapies offer hope for improved outcomes. Multimodal approaches, which combine surgery, radiation therapy, chemotherapy, and newer treatments like immunotherapy and targeted therapy, are increasingly being used to optimize treatment effectiveness. Please be aware that everything discussed in this video is unbiased, verified with facts, and approved by a licensed healthcare specialist before we proceed. This video aims to examine mesothelioma and throw light on the several cures for the condition. In light of that, let's start by talking about the numerous ways of curing mesothelioma. While mesothelioma remains a challenging disease to cure, significant advancements in recent years offer hope for improved outcomes and potentially moving closer to a cure. Chemotherapy. Chemotherapy involves the use of drugs to kill cancer cells or inhibit their growth. It is typically administered intravenously or orally and works throughout the body to target cancer cells. In mesothelioma, chemotherapy is often used as systemic treatment to shrink tumors, relieve symptoms, and improve overall survival. Researchers are continually exploring new chemotherapy drugs and drug combinations to enhance effectiveness and minimize side effects. They also investigate novel delivery methods such as intracavitary or intraperitoneal chemotherapy to directly administer drugs to the affected areas. Surgery. Surgery plays a critical role in the treatment of mesothelioma, particularly in cases where the disease is localized and can be completely resected. The two primary surgical procedures for mesothelioma are pleurectomy or decortication, PD, and extrapleural pneumonectomy, EPP. PD involves removing the pleural lining and visible tumor nodules, while EPP entails removing the pleura, affected lung, part of the diaphragm, and nearby tissues. The goal of surgery is to achieve complete tumor removal and potentially cure the disease. Researchers focus on refining surgical techniques such as minimally invasive approaches to reduce post-operative complications and improve patient outcomes. Radiation therapy. Radiation therapy uses high-energy X-rays or other radiation sources to destroy cancer cells or inhibit their ability to divide and grow. It is typically delivered externally using a machine called a linear accelerator. In mesothelioma, radiation therapy is commonly used as an adjuvant treatment following surgery to kill remaining cancer cells or as palliative treatment to alleviate symptoms. Researchers explore advanced radiation techniques such as intensity-modulated radiation therapy or IMRT, which delivers precise radiation doses to tumor areas while minimizing exposure to healthy tissues. Proton therapy, another advanced technique, uses protons instead of X-rays, allowing for more precise targeting of tumors and reducing radiation exposure to surrounding organs. Tumor treating fields or TT fields. TT fields therapy is a novel treatment approach that applies low-intensity, alternating electric fields to disrupt cancer cell division. The treatment is delivered using a portable device called an option system, which creates electric fields that interfere with cell division and cause cancer cells to die. In mesothelioma, TT fields therapy has been approved as a treatment option in combination with chemotherapy for unresectable or locally advanced diseases. Researchers are investigating the effectiveness of TT fields in different stages of mesothelioma and exploring its potential synergy with other treatment modalities to enhance tumor response and improve outcomes. Multimodal approaches. Multimodal therapy involves the use of multiple treatment modalities in a coordinated manner to improve treatment outcomes and potentially achieve a cure. In mesothelioma, multimodal approaches typically include a combination of surgery, chemotherapy, and radiation therapy. The specific sequence and timing of these treatments vary based on individual patient factors and disease characteristics. Researchers are conducting clinical trials to evaluate different combinations and sequences of these treatments, as well as exploring the integration of emerging therapies like immunotherapy and targeted therapy. The goal is to identify the most effective multimodal regimens that can maximize tumor response, prolong survival, and potentially cure mesothelioma. It's important to note that mesothelioma is a complex and challenging disease, and finding a definitive cure remains a significant goal. However, through ongoing research efforts and advancements in treatment modalities and multimodal approaches, researchers strive to improve outcomes, extend survival, and ultimately work towards finding a cure for this devastating cancer. Research efforts have focused on understanding the underlying molecular mechanisms of mesothelioma, identifying specific genetic and molecular abnormalities associated with the disease, and developing targeted therapies to disrupt these processes. Researchers aim to enhance treatment effectiveness and potentially achieve long-term remission or cure by targeting specific molecular pathways involved in mesothelioma cell growth and survival. Studies focus on finding a cure for mesothelioma as an active and ongoing area of study. Scientists and medical professionals worldwide are dedicated to understanding the disease better, identifying new treatment options, and ultimately finding a cure. Here are some key areas of research in the quest to find a cure for mesothelioma. Molecular understanding. Researchers are delving into the molecular intricacies of mesothelioma to gain a deeper understanding of the disease. Through advanced genetic and molecular profiling techniques, they are identifying specific genetic mutations and alterations that drive the growth and progression of mesothelioma tumors. By comprehending these molecular mechanisms, scientists can develop targeted therapies that specifically disrupt the processes fueling the cancer cells, potentially leading to a cure. Targeted therapies. Targeted therapies are designed to selectively attack cancer cells by blocking or inhibiting specific molecules or signaling pathways involved in tumor growth. For mesothelioma, researchers are investigating various targeted therapies that interfere with key molecular targets such as FGFR, EGFR, and VEGF. Clinical trials are evaluating the effectiveness of these targeted therapies in shrinking tumors, extending survival, and ultimately working towards a cure for mesothelioma. Immunotherapy. Immunotherapy has shown significant promise in the treatment of various cancers, including mesothelioma. This approach harnesses the body's immune system to recognize and destroy cancer cells. Researchers are studying different immunotherapeutic strategies, such as immune checkpoint inhibitors, drugs that release the brakes on the immune system, cancer vaccines, stimulating the immune system to recognize and attack cancer cells, adoptive T-cell therapy, infusing patients with genetically modified immune cells to target cancer cells, and oncolytic viruses that selectively infect and kill cancer cells. These approaches aim to boost the immune response against mesothelioma and potentially lead to a cure. Combination therapies. Combining multiple treatment modalities has become a key focus in mesothelioma research. By using a combination of surgery, radiation therapy, chemotherapy, immunotherapy, and targeted therapy, researchers hope to maximize treatment effectiveness and increase the likelihood of a cure. Clinical trials are evaluating different combinations and sequences of these treatments to determine the optimal approaches for individual patients. Early detection and screening. Detecting mesothelioma at its earliest stages greatly improves treatment outcomes. Researchers are working on developing improved screening methods and biomarkers that can detect mesothelioma at an early stage. Blood-based biomarkers such as soluble mesothelin-related peptides or SMRP and genetic profiling are being investigated to enhance early detection. Imaging techniques such as positron emission tomography, PET, and high-resolution computed tomography, CT, are also being refined to improve the accuracy of diagnosis and staging. Genetic studies. Genetic studies are shedding light on the genetic predispositions and risk factors associated with mesothelioma. By studying the genetic basis of the disease, researchers aim to identify individuals at higher risk and develop personalized prevention strategies. Furthermore, genetic profiling of mesothelioma tumors can help identify specific alterations that can guide treatment decisions and identify potential therapeutic targets. Supportive care and quality of life. While finding a cure is a primary goal, researchers are also committed to enhancing supportive care and improving the overall quality of life for mesothelioma patients. Studies are focusing on managing symptoms, reducing treatment side effects, and developing supportive care interventions to address the physical, emotional, and psychosocial needs of patients and their families. While a definitive cure for mesothelioma has not been achieved, the ongoing research efforts and advancements in understanding the molecular mechanisms of the disease, developing targeted therapies, and improving early detection and supportive care are bringing us closer to the goal of finding a cure. As always, we care about your health. If you enjoyed watching Vital Health TV and learned something from this video, please hit the like button and subscribe to our channel for more videos like this. Thanks for watching.